Hi everybody, my name is Advait and today I'm going to talk about how to approach a case of a panic attack. And the treatment of a panic attack is benzodiazepine, encouraging the patient to slow his or her breath and sending them home with reassurance, with counseling and patient education. The long-term management of panic disorder is cognitive behavioral therapy and pharmacotherapy like SSRI, which is first line, SNRIs like venlafaxine, and TCAs, MAO inhibitors, benzodiazepines, etc. But how will you approach a case of a panic attack when you really see it? Because these patients would present as some in the emergency department with some symptoms like chest pain, palpitation. So how will you do a workup in such a patient? These patients will present with symptoms like chest pain, palpitation, and they would present in the emergency room. So how will you do workup of such patients? So here I'm going to outline which steps you can take to figure out what's going on and make a diagnosis of a panic attack. So first off, we'll start with emergency orders. The first thing you need to do is you do not want to miss a possible critical condition. It is chest pain, treat it like a chest pain. So I want you to make sure that your emergency orders in place like pulse oximetry, oxygen, IV line, cardiac monitor, ECG, and glucometer glucose. You can also set up a BP monitor if you want. But these things are very critical so that you don't miss an emergency condition. What if it's not a panic attack? So you have to start with emergency orders, and this is before any kind of physical examination. You have to do this before the physical examination. And then you have to do initial focus exam. You do a general exam, head and neck, chest, lung, cardiovascular, abdominal extremities exam, and you don't do unnecessary exams like breast, lymph node, or genital exam. After treating the condition, you can do an interval physical examination later, like repeating general CV, lung examination, or perform a psychologic examination. So all of that has to be done later, not initially. Initially, you want to make sure that it's not an emergency. So you need to make sure that the orders are in line. You have vitals, monitoring of vitals, cardiac activity, and all of that. After that, you want to make sure that you run some blood tests like CBC, basal metabolic profile. You can do a TSH, urinalysis. You can do a toxicology screen, and also cardiac enzymes. Necessarily, you can also do ABG if a patient has shortness of breath. You can do a lipid profile, depression index. You can order a chest X-ray if you feel something's going on um, in the patient's case, because you have to make sure that this whatever the chest pain is not an emergency. Coming to therapy, after you diagnose everything and you think that there's nothing and it is a panic attack, you gather history and find out that the patient may have panic attack. You give benzodiazepines, and you can start SSRI later. You can reassure the patient and let them know that all of the tests have been fine and they need not worry. Nothing is happening. It's not an emergency. I mean, um, you don't have to dismiss patients You have to explain, you have to understand why the patient is feeling that. So you always ask open-ended questions. You do not say, no, you're not suffering from anything. You do not say anything that is judgmental or anything that is out of line. You have to be behaviorally sound, and you have to let them speak their mind, and you have to ask open-ended questions like what is happening, and you want to reassure, and you want to reassure in a positive way. You want to tell them that you haven't found anything that is concerning, and that is good news. So you have to break the good news in a way that doesn't sound judgmental. It shouldn't never be judgmental. It should be like counseling. Counsel the patient, you tell them, explain them to not have coffee, nicotine, or alcohol, and live a healthy lifestyle, eat a good diet, and follow up with the patient. And tell them that you are there to take care of them. In this cases, you shouldn't order medication that would worsen the patient's condition, like flumazenil, cholecystokinin, isoprol, all these medications. You should complete emergency orders first, and then you should do the physical examination in possible critical condition. And you should not delay ECG in any case of chest pain. So all of this are the primary things that I wanted to say, because it's very important to first be done with emergency order, do a focused physical exam, obtain the results, explain the patient, and do counseling. So that is how you manage an acute episode of panic attack. Thanks for watching, and I'll see you in the next one.